Hello, I'm Romel Redoblado, circulating nurse in cardiovascular surgery at All Saints Hospital in Racine, Wisconsin. The surgical timeout is a standard part of surgical safety in operating rooms throughout the United States. In January of 2009, the Joint Commission revised the Universal Protocol. This video is designed to help you conduct a surgical timeout appropriately. Please pay close attention. The timeout is initiated by a definite pause in room activity after the patient is positioned and before the procedure is started by a designated member of the perioperative team and is performed in a standardized fashion. Utilizing the chart, the operative team ensures the patient is identified using two patient identifiers. All Saints Hospital Racine has chosen the patient's name and the patient's date of birth as these identifiers. Ensures the surgeon's order for the procedure and consent are the same. Ensures the correct side is marked and initialed, or have an alternative verification of an armband on the side of the procedure indicating patient's name and procedure, and site or side, and must be documented in the medical records. Verifies the correct patient position. Verifies that the correct implants and equipment are available and in the room. Verifies the correct diagnostic and radiology test results are properly labeled. Communicates allergies the patient may have. Communicate that prophylactic antibiotics have been given within 60 minutes prior to incision. The circulating nurse and surgeon verbally verify visualization of site marks, and the team communicates safety precautions based on patient history or medication use. Finally, the circulating nurse documents the timeout in an intraoperative record. The timeout involves interactive verbal communication between all team members, and any team member is able to express concern about the procedure verification. If there is any discrepancy in the understanding of the procedure, any team member of the operative team may halt the procedure. The discrepancy must be corrected before the procedure continues. When two or more procedures are being performed on the same patient, a timeout is performed to confirm each subsequent procedure before it is initiated. The operative team performs a timeout on all procedures, and the circulating nurse ensures all team members are in the operating room and there is 100% participation of all team members involved in the case. Good morning.
This is Cindy Bell.
Hi, how are you this morning? My name is Romel. I'm one of the OR nurses working here. Who are you?
Cindy Bell,
Cindy Bell. Great. And when were you born?
7/26/65.
Wonderful. And are you allergic to any medications we should be aware of?
Yes, I'm allergic to sulfa.
Excellent. And what type of procedure are you having done today?
I'm having a clot removed from my lower right leg.
Okay, so it's a right thrombectomy, right lower extremity thrombectomy with possible revision of a graft. Is that correct?
That's what he said.
Okay, and I see that Dr. Kevin White has already marked your leg. You agree that that's where you're having your surgery done?
Yes.
Wonderful. Did you meet the rest of our staff?
Hello. Joanna.
This is Joanna. She's a surgical technician.
Nice to meet you.
And you've already met Deb over here. And Dr. Ippolito is joining us today as well. So.
Yeah, Take Five. It's 5 kids, and also it's a famous song by Dave Brubeck.
All right, everyone.
I think Dave Brubeck.
Hello, are we ready to go?
Yes, we are.
Dr. White, may I please have everyone's attention? We're going to do a timeout, please. This is Cindy Bell. Her date of birth is July 26, 1965. She is allergic to sulfa drugs. Her medical history includes high blood pressure and angina. The patient consented to a right lower extremity thrombectomy with possible revision of a graft. The correct leg is visibly marked and initialed by Dr. Kevin White. She's in a supine position. All equipment and implants for right lower extremity thrombectomy are in the room. The patient's CAT scan and angiograms are available in the PAC system. The patient has 2 units of packed red blood cells available in the blood bank. And has the antibiotic been given, Dr. Polito?
Yes, she received 1 gram of Ancef IV.
Thank you. Are there any other additional information that needs to be addressed?
Yes, she received 12.5 milligrams of metoprolol this morning.
Thank you. Does everyone agree with that?
I agree.
Wonderful. Dr. White, you're good to go.